We're here with Kate Hodgson, a volunteer at St. Paul's Hospital in spiritual care. Welcome.
Thank you. Nice to be here.
Yes, so as a volunteer, what do you actually do?
Well, I'm a volunteer for a specific denomination, the Roman Catholics, and I go in once a week to take communion around to those Catholics in the hospital who have specified that they would like to receive that. And I should say that St. Paul's Hospital has separate funding for spiritual care, so we still have the full department. It's not been affected by the provincial cuts. But doing the work I do as a volunteer, it's made me really aware of what's going to be missing in the other hospitals, because I depend so much on the staff to provide me with support and to, have given me some training and just be there when I have a question or I need something.
So what kind of training have you had, or what kind of training does a person need?
Well, first of all, there's simple stuff like I don't have a medical background. I have to know about, when to gown and glove and how to do it safely for both me and for the patients. And I need to know, just have a little sense of hospital protocol. And I had to go through security check and get references and so on. So I know with this backing that I have the confidence to walk into a hospital and not feel out of place, or that anyone would perceive me as being harmful, because, they know I'm a legitimate volunteer. And when I heard about the cuts, one of the things I thought was, well, this is really crazy. Yes, there's a budget line item, but there's also probably dozens and dozens and dozens of volunteers who are now out of a volunteer job that wasn't costing the government anything. So it seems kind of ridiculous.
That does seem ridiculous, for sure. So then, of course, because there's no one to coordinate them anymore? Or?
Well, it's harder, and Jackie touched on how the burden has fallen on chaplains associated with various denominations and religions. It gets more granular. What about somebody who's Wiccan? And occasionally I've seen that on a chart, and I think that's really cool. I hope someone in spiritual care has a contact out there that can visit this person. And sometimes, a nurse will spot me and say, could you go talk to so-and-so? She'd like someone to pray with. And she may not be part of my tradition, but of course I will. And of course, it's that listening role that Jackie touched on. As a volunteer, I can definitely say, hey, I've got time. I've got all day. I'm not on anybody's clock. And if someone wants to talk, and sometimes they do, sometimes they don't, it's really, really an honor for me to listen to them. It really feeds my faith. So I think it's not just the patients who are getting kind of kicked in the teeth with these cuts. It's also a whole team of often retired people who now are doing with our lives what we think is important instead of what we had to do to earn a living. So.
And why do you think that spiritual care is so important?
Well, one of the things I've noticed occasionally, because one of the areas I go to is the palliative care unit, perhaps the patient has a very deep religious faith, but no one else in the family does. The children, the grandchildren, they've moved away either from that denomination or from organized religion, period. And that's a big discomfort. But to have a spiritual care person to ensure that the patient gets what they want and the family is comforted knowing that it's happening, but they're not out of their comfort zone, is huge. It helps both of them.
So you're kind of the ears and listening and letting people share.
Exactly. Yeah. And it's a comfort thing. And it's also very inspiring and helpful for a volunteer going into the hospital to really see your own life in the perspective of what everyone else is going through. You see immense courage. You see great suffering. And you're reminded that this is going to come to us all. So it's a good time. I always walk out feeling very moved by something that's happened or something someone has said. And it's a great privilege.
That's a beautiful word, isn't it? That we can have the privilege to be with somebody.
Exactly.
When they're suffering. And, talk about some of that patient care that you've given, some of the experiences you might have had.
Sometimes it's just a case of talking about normal things like the weather and cats or dogs or their pets, or listening to what their concerns are. Or one time I had a wonderful time talking to a woman who got talking about what she did for a living. She was very elderly, and she had worked in this job, and she'd worked for this department in the government, and she'd worked in a store. And it was like she moved away from her pain for the time we were talking, and her fears and anxieties, and just shared something about the happier times in her life. And I was really fascinated. She was a wonderful individual, and it was really nice to learn that about her. And so you just never know what's going to happen.
And giving someone the precious gift of time. Talk about that experience.
Well, okay, something really basic and silly, but we can do. We have a program at St. Paul's where a group of volunteers have coordinated with florists who donate flowers that are, when they're changing out their stock. And so we have an area where they make up arrangements and take flowers around to people. Now that has no denominational attachment. It's just a bouquet for anyone who doesn't have flowers. So I was there on Saturday, and I noticed this woman had this lovely flowers a friend had brought in, and they were stuck in an inappropriate medical thing, and they were kind of splaying all over. And I said, would you like me to go get you a proper vase for those? And so I knew where the sterile vases were, and came back with it. Well, no nurse has time to do that. And no nursing assistant has time to do that, and even housekeeping doesn't have time to do that. So it was a small gesture, but it made the bouquet look better,
and probably the person feel better. So as a volunteer, you can do many facets and many different things. And so are they looking for more volunteers, or they don't have room now because of cuts?
Well, I know they're always happy to get volunteers at St. Paul's, and also there's still volunteer coordinators in other areas in hospitals, not just spiritual care. And I think some of the coordinators are trying to help out if they can. So definitely I would advise anyone who wants some really excellent use of some of their time to volunteer.
So is there a website, or is there some contact
I think you just approach,
person?
I think any hospital would have a volunteer coordinator you could check
So you can just phone the hospital and find it.
Yeah, exactly.
Well, you rock for volunteering and being on my show and sharing about spiritual care and the importance of spiritual care.
Thank you.
Thank you very much, Kate. I hope you enjoyed today's show with Simon Lasserre with the Canadian Association for Spiritual Care, Jackie Suretsky with the coordinator for the Catholic Chaplaincy, Roman Catholic Hospital, and also Kate Hodgson as a volunteer. If you'd like to share your story, contact me and tell me why you rock. Thanks for rocking in and having a conversation with Marion. I'm Marion, and you rock.